Now it's National Diabetes Awareness Month, and so this week inside Body Talk, we look at a type of diabetes that affects pregnant women. I have with me consultant obstetrician Dr. Leo Walker, who is here to help us understand this potentially serious condition called gestational diabetes. Hi, good afternoon to you, Dr. Walker. Thank you so
Hi,
much for joining us.
hi, afternoon. It was a pleasure.
Great. How are you doing today?
I'm not bad. I'm not bad. How are you?
I'm good. Thank you so much for asking.
No
So,
problem.
we hear this word gestational diabetes, but some people only know about type 1 and type 2
Right,
diabetes.
right.
So, doctor, what is gestational diabetes?
Well, gestational diabetes simply refers to the first recognition of impaired glucose tolerance in pregnancy. So it's very closely related to type 2 diabetes, in that the individual's cells have difficulty dealing with the excess glucose in the system, or what patients refer to as having as a impaired insulin sensitivity. So the insulin is present, however, it's just not doing its job in terms of mopping up all that excess glucose. It's a similar situation in pregnancy, in that pregnancy is what we refer to as a diabetogenic state, meaning there are certain hormones which are released in pregnancy, which impairs this individual ability to uptake glucose and store glucose effectively. So, for all pregnant patients, we usually perform a screening test for gestational diabetes, as our population is characterized as a high risk population in that individuals of Afro Caribbean descent.
Right. Uh, Doctor, what causes gestational diabetes?
Well, the truth is the pregnancy itself. There are several hormones which are released or increased in terms of the volume of these hormones in pregnancy, specifically things like cortisol, progesterone, human placental lactogen. All of these are hormones which tend to increase an individual's insulin insensitivity, and therefore makes the likelihood of developing gestational diabetes higher.
Right. How common is this in Jamaica?
Well, it's actually pretty common. Majority of cases range between around 15 and 20% of pregnant patients.
Hmm.
Our population is inherently a high risk population in that we are, as I mentioned, of Afro Caribbean descent. But there are other things which may increase the likelihood of gestational diabetes. For example, individuals who were overweight or obese prior to pregnancy have an increased risk of developing gestational diabetes. Individuals with a previous history of gestational diabetes or previous gave birth to a previous infant greater than 4 kilograms. These are the things which are likely to increase the likelihood of developing gestational diabetes.
Thank you so much, Dr. Leo Walker. If you're just joining us, I want to say we're live on Facebook and we're live on YouTube as well. Love 101 FM Jamaica. You can jump on. I'm talking with obstetrician Dr. Leo Walker, and we're talking about gestational diabetes. Now, what category or categories of pregnant women are most at risk? Well, you just said overweight, but separate and apart from the overweight, if you would have had that issue before, what other categories do we have?
Well, definitely those are what we tend to refer to as the higher risk population. Now, especially individuals who may be on medications prior to pregnancy, which predisposes them to have impaired glucose tolerances. So, individuals on long term or high dose steroid therapy. Those are also individuals who are more likely to develop gestational diabetes in the pregnancy itself. So it really comes down to majority of lifestyle modification. What we know is that for those individuals who achieve a normal BMI prior to pregnancy, risk of developing gestational diabetes decreases significantly. So that is usually one of the things that we can do to minimize an individual's risk. Certainly things like genetics do play a significant role. If you have a strong family history of gestational diabetes, that's certainly not anything that you can avoid because that is something which is non-modifiable. The modifiable risk factors, however, do play a significant role in reducing the risk.
Thank you. What are some symptoms associated with gestational diabetes?
Well, usually patients or the symptoms which are associated with gestational diabetes are usually intertwined with some of those symptoms that you would normally see in pregnancy. For example, frequent urination, polyphagia, that is, having a very large appetite, drinking a lot. All of these things are things which can happen in a normal pregnancy. So we tend to not rely on the symptoms themselves to make a diagnosis. Usually, what we require on is the blood test, what we call the O'Sullivan's test, which is usually done between 24 and 28 weeks of the pregnancy.
Yeah.
Certainly, there are overt signs which may suggest gestational diabetes. For example, if you have a large volume of amniotic fluid in the pregnancy, if the baby is extremely big or macrosomic, that is greater than 4 kilograms, those are things which may close in that a patient may have had gestational diabetes. But certainly at that point, it would be too late, which is why we often want to do the screening so we can address it before it becomes significantly symptomatic for both the mother and the fetus.
All right. So how do we know? Well, or do they know that they have gestational diabetes? How, I don't know. How do they know?
Well, usually at around 24 to 28 weeks, as a part of the standard antenatal screening, we
Yes.
perform the O'Sullivan's test, which is
Oh,
a test where the patients are often fasted. They're given a 50-gram glucose solution to drink, and shortly thereafter, we draw some blood. Based on that result, that is what would close into the potential diagnosis of gestational diabetes.
right.
So if the patient gets a result of greater than 7.8, we then move on to do the confirmatory test. So I often refer to the OST as the screen, just like when you're going to the airport,
Yes.
you're passing through that initial metal detector. If it goes off, then they do a closer check to see what was the reason why it went off. The similar
Right.
thing with the O'Sullivan's test. Perform that initial test. If we get an elevated result, we then move on to take a closer look and do the confirmatory test.
Beautiful. So as long as you're pregnant and you go to do your checkup, the
Absolutely.
obstetrician will
Yeah.
indeed screen you for that.
Right. So all pregnant patients, 24 to 28 weeks, will require the O'Sullivan's test.
Beautiful. How is it diagnosed?
Well, the diagnosis is based on now what we call the oral glucose tolerance test. So for this, we give a patient a specific 75-gram glucose solution. They drink it, and we take the blood sugars 1 hour and 2 hours after that initial test. That is subsequent to having a fasting blood sugar done. And we use those three values, the fasting, the 1 hour, and the 2 hour, to make the diagnosis. Now, any one of those three tests returning abnormal results gives us a positive diagnosis of gestational diabetes. So you only need one out of three of those to be abnormal for us to make the diagnosis. Once the diagnosis is made, then we'll start to proceed in terms of how we're going to address it and manage it to reduce maternal as well as fetal risk.
Right. Now, how serious can this condition be?
Well,
Or
gestational diabetes in itself, the diagnosis, doesn't carry with it significant perinatal morbidity or mortality.
right.
Untreated gestational diabetes or gestational diabetes which is unmanaged or mismanaged can have significant sequelae for both the mother and the fetus. Now, in terms of for the mother, the long-term complications of impaired glucose tolerance can spill over to even the postpartum period, where patients are now increasing the risk of developing, as you mentioned, diabetes mellitus type 2 later on in life. So gestational diabetes in itself, particularly if it's mismanaged or not diagnosed, can increase risk of an individual developing type 2 diabetes later on in life.
Right.
For the fetus, again, significant risk of one, stillbirth. So, particularly if this patient has uncontrolled and very high sugars, this significantly increases the risk of stillbirth at term. Babies can often grow to be very big. The amount of fluid in the amniotic sac can exceed what is considered to be normal, and that predisposes the patients to increased risk of preterm labor, preterm birth, as well as several complications during the labor process. If baby is too big, then there can be difficulty actually delivering the baby vaginally, and parts of the shoulder can become stuck during the vaginal delivery, which can result in some degrees of nerve injury, as well as death if baby is not delivered within a timely fashion. So all of these things, is simply associated with the diagnosis of gestational diabetes, but also if it's not managed correctly. Of course, the management is what is going to reduce the potential for some of these risks to occur.
Right. Yeah, that sounds I love it. Right, right. I'm just scared. I'm like, so do we have treatment options available for this?
Of course, and it's twofold. It's what we call lifestyle modification, but there's also medical management. Of course, the first prong or the first step of treatment is appropriate diet and exercise. Now, the key to the diet is not weight loss, but it's just to monitor the type of foods that we're taking in. So, for example, for pregnant patients who have gestational diabetes, we advise them to avoid simple sugars. So, mangoes, white rice, white bread, very greasy or oily food. We want them to cut down on those things and eat more complex carbohydrates. So, more things containing starch. The body will take a much longer time to break down that starch into glucose. So, there isn't these sudden spikes in the blood sugar levels. Of course, we often advise exercise, particularly upper body exercise, so that the body can utilize some of that excess glucose
Right.
and convert it into energy to
Energy.
use. Right? So those are basically the basic lifestyle modifications. And there are patients who respond well to simple diet and exercise, and the sugars are controlled thereafter. For those patients who have difficulty controlling the sugars, despite appropriate diet and exercise, those are the patients who will now benefit from medication, which can range from tablets such as metformin to insulin for those patients who need to get very tight and rapid control of those sugars.
Right. So you mentioned to avoid mango. I know, I have to just say mango. And you mentioned others that we should avoid. But what can we, why do I keep on saying we? What can the ladies, the females, the women who are pregnant, what can they eat, as
Well,
the
well,
good starch?
yes, so certainly we want to avoid things which have a high glucose content, which is where the mangoes would come in.
Yes.
Mango is a very popular fruit in Jamaica. A lot of patients love mangoes. Unfortunately, it has a whole lot of glucose as well, and that is not good when we're talking about gestational diabetes.
Right.
So it's not that it's something that they can't eat, but they have to eat it in very tight moderation. White rice, again, it's very easily converted into glucose, which can cause spikes in the sugars. So we tend to say if you're going to eat something, eat, brown rice. If
Brown
you're
rice.
going to eat pasta, eat wheat pasta. If you're going to eat bread, eat wheat bread.
Wheat bread.
Right. So all of these things has way more starch as opposed to simple sugars like glucose. So the
Oh,
starch will eventually be converted into glucose, but this is done over time, and therefore the body is better able or capable of maintaining these sugar levels. Once you eat something which has very high content of glucose, you get an immediate spike in the blood sugars, which is not what we want.
right. Thank you. So you have dieting and exercising to curb
Absolutely.
this, or you can have the medical treatment that's available for this, for gestational diabetes. Now, Dr. Leo Walker, where is your practice found? How can people connect with you?
Well, I'm located at the Westminster Medical Center. That's 1A Westminster Road.
Yes.
I'm also located at the Oxford Medical Center. That's 22 Old Hope Road. You can also find me on Instagram at Dr. Leo Walker, as well as contact me at 876-372-3790.
Repeat that number for me again, 372.
3790.
All right. Thank you so much. Any final words before we wrap?
Absolutely. Gestational diabetes is extremely important. All pregnant patients should be screened for gestational diabetes to avoid any of the significant complications or sequelae of same, which are totally avoidable.
Right. Thank you so much for sharing inside Body Talk on this Make Me Move Monday. Very informative piece
Thank
there.
you for having me.
Yes, yes, from Dr. Leo Walker. You're welcome.
All right, take care.
You're welcome.
Yeah, man.
You too. Gestational diabetes. I bet some of you guys never know about gestational diabetes. Because I did not know before this. Or before when? Before Friday, I did not know about gestational diabetes. Yeah, but now we know, right? If you never know, now you know.